Have you ever wondered whether intimacy after 60 can feel as good or even better than it did when you were younger? Many men assume that changes in sexual performance, desire, or stamina mean the best days are behind them. But the truth is, science shows that intimacy does not have to fade with age, and in fact, many men discover deeper pleasure, connection, and confidence later in life when they understand what is happening to their bodies and how to adapt. The big question is, how do you keep passion alive, overcome the natural changes of aging, and avoid falling into the trap of thinking it's too late? The answers may surprise you, because research now points to lifestyle, medical advances, emotional health, and honest communication as powerful tools for rediscovering intimacy at any stage of life. Aging naturally brings changes to the body. Blood vessels become less elastic, nerves transmit signals a little slower, and testosterone levels often decline gradually. These changes can affect energy, erections, and desire. At the same time, many men over 60 live with chronic conditions such as diabetes, high blood pressure, or heart disease, and the medications used to treat these conditions can sometimes affect sexual function. That is why doctors often say erectile dysfunction is not just a bedroom issue but a whole health signal. In fact, erectile problems can sometimes appear years before heart disease is diagnosed, making them an important early warning sign. Instead of seeing changes as failure, it helps to recognize them as signals from your body that deserve attention and care. One of the most effective ways to restore intimacy is to focus on overall health. Exercise is a cornerstone. Brisk walking, swimming, cycling, or resistance training improves circulation, builds stamina, and supports hormone balance. Research shows that men who follow regular physical activity programs often report improved erectile function, better mood, and more confidence. Alongside exercise, diet plays a major role. The Mediterranean diet rich in vegetables, fruits, legumes, whole grains, fish, nuts, and olive oil has been shown to improve blood vessel health and reduce cardiovascular risk. Since good blood flow is essential for erectile function, it is no surprise that this way of eating also supports sexual health. Small daily choices, like replacing processed snacks with nuts, choosing fish instead of red meat, or cooking with olive oil instead of butter, can build powerful long-term results. Sleep is another often overlooked factor. As men age, sleep quality sometimes declines, yet deep restorative sleep is critical for testosterone production, energy, and desire. Sleep apnea, which is common after 60, not only reduces oxygen levels but also contributes to erectile dysfunction and fatigue. Treating sleep apnea with lifestyle changes or devices such as CPAP can improve not only health and longevity, but also intimacy. Going to bed at consistent times, limiting alcohol, reducing screen use before bed, and creating a restful environment are simple but effective strategies to improve sleep quality, which in turn strengthens sexual vitality. Medications can have both positive and negative effects on intimacy. Some blood pressure drugs, such as older beta blockers or certain diuretics, may contribute to erectile difficulties, while newer alternatives may have fewer sexual side effects. Antidepressants, especially SSRIs, can also dampen libido or delay orgasm. It is important never to stop a prescribed medication on your own, but it is worth asking your doctor if an alternative might be suitable. At the same time, modern medicine offers powerful treatments specifically for erectile dysfunction. PDE5 inhibitors such as sildenafil, tadalafil, vardenafil, and avanafil are among the most widely used. They work by enhancing blood flow to the penis in response to arousal. For many men, they restore confidence and function, but they are not safe for everyone. Men who take nitrate medications for chest pain or certain heart conditions must not use PDE5 inhibitors, because the combination can dangerously lower blood pressure. That is why medical supervision is essential. For those who cannot take pills or do not find them effective, other safe options exist, including vacuum erection devices, penile injections, intraurethral suppositories, and even implants. With proper medical guidance, most men can find a solution that fits their health needs and personal preferences. Beyond physical treatments, intimacy after 60 often benefits from a broader view that includes psychological and emotional factors. Many men experience performance anxiety, fear of disappointing a partner, or stress about changes in their bodies. These feelings can create a cycle that worsens erectile problems even if the physical issue is mild. Therapy or counseling, especially sex therapy, can break this cycle by providing strategies to reduce anxiety, build confidence, and focus on pleasure rather than performance. Techniques such as sensate focus, where couples practice non-sexual touch and gradually reintroduce intimacy, help remove pressure and rebuild closeness. When couples learn to communicate openly about desires, concerns, and comfort, intimacy often improves regardless of physical changes. Testosterone is another area of interest for many men over 60. Levels do decline with age, but this decline is usually gradual and does not always require treatment. True low testosterone or hypogonadism is diagnosed only when symptoms such as fatigue, low libido, and reduced muscle mass are combined with consistently low testosterone levels on multiple tests. In such cases, testosterone replacement therapy may be considered. Recent studies, including large clinical trials, suggest that testosterone therapy can improve energy, sexual desire, bone density, and red blood cell counts in men with genuine deficiency. However, it is not risk-free. Some men may experience elevated blood pressure, changes in cholesterol, or issues with prostate health. That is why professional guidelines recommend testosterone therapy only after thorough testing and medical evaluation, not as an over-the-counter boost or anti-aging shortcut. Supplements that claim to raise testosterone naturally are often unregulated and lack solid evidence, so they are best avoided. Safety is a critical but sometimes forgotten part of later life intimacy. Sexually transmitted infections remain a concern, and rates of conditions such as syphilis have risen in recent years among older adults. Because many people over 60 re-enter the dating scene after divorce or widowhood, they may underestimate the risk of STIs. Condoms, open communication with new partners, and routine health checks are important at any age. Protecting your health protects your partner's health too, and fosters trust and confidence in new or ongoing relationships. Beyond medical treatments and safety, everyday habits can make intimacy more comfortable and enjoyable. Hydration, limiting alcohol, and timing medications earlier in the evening can prevent side effects that interfere with intimacy. Using pillows or supports can reduce joint strain or back discomfort, especially for men with arthritis or limited mobility. Couples can experiment with positions that feel good without causing pain. Lubricants and vaginal moisturizers can help if a partner experiences dryness, which is common after menopause. These small adjustments may seem simple but can transform experiences, making intimacy less stressful and more pleasurable for both partners. Emotional connection is just as important as physical performance. Intimacy after 60 is often about quality, not quantity. Many couples find that slowing down, focusing on touch, massage, and emotional closeness creates deeper satisfaction than before. For some men, reframing intimacy from being a goal to being a shared experience reduces pressure and builds confidence. Couples who talk openly about what feels good and what feels challenging are more likely to find creative solutions and maintain a fulfilling sex life well into later decades. Practical steps can help men apply all this information. Schedule a routine medical checkup if erectile changes appear, both to rule out cardiovascular risks and to discuss treatment options. Make daily exercise and a balanced diet non-negotiable foundations for health. Improve sleep hygiene and screen for sleep apnea if snoring or fatigue are issues. Discuss medications with your doctor to check whether adjustments might improve sexual function. If you consider ED treatments, follow your doctor's instructions carefully and remember that sometimes it takes multiple attempts to find the right dose or timing. Combine physical treatments with emotional strategies such as counseling, sensate focus, or simply setting aside time for intimacy without pressure. And if testosterone deficiency is suspected, insist on proper testing before making decisions about therapy. Ultimately, rediscovering intimacy after 60 is about embracing the whole picture: body, mind, and relationship. Sexual health is closely tied to cardiovascular, metabolic, and emotional health. That means every positive step: walking more, eating better, sleeping well, talking openly supports intimacy too. Medical science provides many safe and effective tools, but the most powerful changes often come from how couples approach intimacy together. With patience, curiosity, and evidence-based strategies, intimacy after 60 can be vibrant, satisfying, and even richer than it was in earlier decades.